To talk on behalf of Executive Director Stella Z. Banawis is the Deputy Executive Director of the Employees Compensation Commission, Attorney Jonathan T. Villasoto.
Bukas na araw po sa ating lahat at palugod po nating binabati ang ating po mga panauhin at sa mga kalahok po na ngayong ika-17, ika-17 National Occupational Safety and Health Congress. Ngayon po September 28, 2021. On behalf of our Executive Director, Stella Sipagan Banawis, may we extend our warmest greetings to our friends in the Occupational Safety and Health Center, headed by our Executive Director, Engineer Noel Binay. Magandang umaga po at kumusta po kayong lahat dyan. So, ang ating pong topic ngayon ay tungkol po sa mga policy responses during this COVID-19 pandemic. So, ito po ang ating outline ng ating pong presentation. We will give a brief background on the Employees Compensation Program. And then we will enumerate po yung ating po mga policy responses in this time of COVID pandemic, starting with the enumeration of several resolutions related to this COVID-19 pandemic. And then we will proceed with the providing information on EC benefits and filing process. Next slide. So, on the screen po, according to the experts, Social Security is a basic human right. But before we proceed, may we mention the basic constitutional provisions pertaining to social justice. Alam niyo po mga kababayan, meron po tayong mga bahagi ng ating Constitution, in particular po sa tinatawag na Declaration of Principles and State Policies. Kabilang po doon yung pong pagrespeto ng Estado sa dignidad ng bawat mamamayan at nandun rin po yung pagkilala sa mga karapatang pantao. At patungkol po sa ating mga manggagawa, nandiyan din po ang basic constitutional provisions on protection and promotion of welfare of all workers. Next slide. So on the screen po, ilan lamang po ito sa mga tinatawag po nating mga facts tungkol po sa ating state insurance fund na kung saan po nanggagaling ang ating po mga benepisyo patungkol po dito sa Employees Compensation Program. Bahagi po ng ating slides sa mga figura, mga datos patungkol po sa bilang ng mga membro sa GSIS, sa SSS, at ang kasalukuyan pong halaga ng ating pong state insurance fund sa pribado at pampublikong sektor na sa ngayon po nasa pangalaga ng dalawang ahensya, ang GSIS sa pampublikong sektor at ang SSS sa pampribado sektor. Next slide. Okay. So before we proceed, let us have as a way of a background there. We have a video, animated video po on the Employees Compensation Program.
Doble kayod so you can flex something in the future. Okay lang yan. Basta ingat lang tayo parati ha. At lagi nating tandaan na may ECC na handang umagapay sa'yo. Wait, sino nga ba si ECC? Ang ECC o Employees Compensation Commission ay ang government agency na nagpapatupad ng ECP o Employees Compensation Program. Ang ECP ay benefits sa mga empleyadong nagkasakit, na-aksidente o namatay dahil sa trabaho. Pero bes, huwag kang malilito. Ang ECC ay hindi pareho sa SSS at GSIS. To make it simple, ang ECC ay kahanay ng SSS, GSIS, Pag-ibig at PhilHealth at isa ring social security institution ng gobyerno. Ang ECC ang gumagawa ng mga policies and guidelines tungkol sa Employees Compensation Program. ECC rin ang nagre-review ng lahat ng Employees Compensation claims na disapproved ng SSS at GSIS. ECC was established in 1975 at sa loob ng mahigit na 4 decades, more than 6 million claims na ang natulungan ng ECC na umaabot na rin sa halagang 39 billion pesos. Noise, di ba? Kung private employee ka, pwede kang sabay mag-claim ng EC at SSS benefits. Double recovery of benefits. Double ang compensation. Kung empleyado ka naman ng gobyerno, Maaari kang pumili kung GSIS o EC benefits ang i-claim. Ito ay dahil sa exclusiveness of benefits policy ng GSIS. Ang pinagkaiba ng ECC sa ibang social security institutions ay employer ang nagko-contribute para sa premium contribution mo. Ibig sabihin, hindi ito kinakaltas sa sweldo mo at wala ito sa payslip mo. Employer mo mismo ang nagbabayad ng iyong EC premium contributions. Sa madaling salita, sagot ka ni boss. Sa private sector, 10 pesos per month ang contribution ng iyong employer kapag ang sahod mo ay mababa sa 14,750 pesos. 30 pesos per month naman ang contribution ng iyong employer kapag ang sahod mo ay 14,750 pesos o higit pa kada buwan. Kung sa gobyerno ka naman nagtatrabaho, 100 pesos per month ang contribution ng iyong opisina, regardless kung magkano ang sahod mo. Ang maganda pa sa Employees Compensation Program ay sa unang araw mo pa lang ng trabaho ay covered ka na. O di ba? Protected ka na agad. For more information, pumunta lang sa pinakamalapit na ECC office sa inyong lugar. Remember, kahit may ECC, lagi ka pa rin mag-ingat, ha?
Okay, thank you. But before we proceed sa ating po mga kababayan, at may we emphasize certain pertinent facts based on our animated video. Importante po ito para po mailagay natin sa tamang konteksto ang ating pong pinag-uusapan. First, EC Employees Compensation Program aims to provide disability or death benefits due to work-connected sickness or injury. And then, EC benefits are distinct and separate from SSS and GSIS benefits. Insofar as government agencies are concerned, which are related to the implementation of Employees Compensation Program, for the private sector, SSS serves as the implementing agency. For the public sector, GSIS serves as the implementing agency. And the Employees Compensation Commission serves as the appeal and policy-making body of our Employees Compensation Program. So far as remittance of EC contributions is concerned, as mentioned in our video, ito po ay tanging at bukod-tanging obligasyon lamang ng ating po mga employers sa pribadong sektor at sa lahat naman po ng mga nagtatrabaho sa gobyerno. Kaya ito po ay, kabilang na po ang mga uniformadong personnel, ito po ay obligasyon ng ating po mga respective government agencies. So to reiterate, ECP covers all civilian employees in the government with GSIS coverage, including uniformed personnel. And for the private sector, Employees Compensation Program covers all compulsory members of the SSS. Next slide. So we have here several resolutions and administrative issuances which are related to COVID-19 pandemic. First, we have here the Office of the President Administrative Order number 20, which was issued on April 21, 2020. Okay, directing all government agencies to formulate and issue rules and regulations on the grant of any benefit as a temporary emergency measures to respond to this COVID-19 pandemic. Okay po. Next slide. In compliance with that administrative order, between 2020 and 2021, the Employees Compensation Commission has issued several resolutions, particularly as our response to this COVID-19 pandemic. First, we have Board Resolution number 23-04-14. In this resolution, the Commission has approved the inclusion of COVID-19 in the list of occupational and work-related diseases. Before we proceed, may we mention the relevance or significance in the inclusion of any disease in that list of occupational and work-related diseases. Insofar as our jurisprudence or pertinent rulings of the Supreme Court are concerned, there is a disputable in the event that an illness has been considered as included in that list. There would be a disputable presumption of compensability, meaning in the evaluation of any claims pertaining to that list, which is included in that, pertaining to that illness, which is included in that, there would be a liberality in that in the evaluation in favor of labor. Next slide. So on this slide po shows the figures, particularly on the number of the beneficiaries and the total amount which were granted to our beneficiaries related to work-connected COVID-19. Next slide. So again, we have another board resolution by way of alleviating the financial needs of our pensioners in this time of COVID-19 pandemic. The Employees Compensation Commission, or the Commission, has issued Board Resolution number 2021-04-13, or authorizing the grant of one-time top-up cash assistance of 30,000 for claimants in the private sector with approved temporary total disability benefits and or death with funeral benefits due to work-related COVID-19. May we emphasize that this grant is still pending for approval at the Office of the President. Next slide. So we have here another board resolution. As we have mentioned, this resolution aims to assist our pensioners in the private and public sectors. In summary, this resolution authorizes the grant of one-time financial assistance in the amount of 20,000 pesos to all qualified EC pensioners in the private and in the public sector. Next slide. So what are the other policies as our response to COVID-19 pandemic? We have here board resolution number 20-03-06 for extending the payment deadline for remittance of EC contribution for our employers. And then we have another board resolution number 20-03-07 which aims to expedite the processing of EC claims of workers for diseases acquired in the line of duty during outbreaks, epidemics, and pandemics. Next slide. So again, we have two board resolutions. First, board resolution number 20-07-12, prescribing the guidelines and the interruption of the prescriptive period for the filing of employees' compensation claim. As a general rule, our prescriptive period in the filing of EC claim is within the period of 3 years. But because of this pandemic and to ease the burden of our claimants, the Employees Compensation Commission deems it more prudent to give leeway to our claimants in the filing of EC claim. So in effect, suspended po ang ating prescriptive period during the entire duration po ng declaration of public health emergency due to COVID-19 pandemic. So another board resolution is is number 20-07-13, or granting of EC funeral benefits despite the absence of proof of expenses to funeral services. Previously, we required the submission of official receipts for funeral expenses for all qualified beneficiaries who receive EC death benefits. But because of this pandemic, again, in order to alleviate the suffering of our qualified beneficiaries, the Commission has dispensed the submission of official receipts. In the event that the death would be declared as work-connected, automatic na pong ibibigay ang ating pong EC funeral benefits in the amount of 30,000 pesos for both public and private sectors. Next slide. So another board resolution number 21-03-09. We have here the policy on compensability or disability or death due to injuries within while in the performance of their duties in their residences. Particularly po nag-a-apply ito dun po sa mga naka-work from home arrangement in accordance with our Telecommuting Act and in accordance with the CSC resolutions authorizing the observance of work from home arrangement in this time of COVID-19 pandemic. So in the event that an employee or a worker was authorized to render his duty in his or her residence, kung may mangyari man pong aksidente, posible po yung pagmula ng benepisyo sa ilalim ng Employees Compensation Program. Another board resolution is number 21-03-08, granting of compensation under PDC number 626 to all serious adverse events due to inoculation. Kung mayroon man pong komplikasyon ang ating po mga bakuna dahil po sa COVID-19 at yan po ay nangyari sa ating po mga covered members, posible pong pagmulan din yan ng EC benefits. Next slide. So, we will play another po on the succeeding presentation. We have another animated video describing or showing the process of filing of EC claims as well as the corresponding benefits under the Employees Compensation Program. Okay?
Nagkasakit o na-aksidente sa work? Don't worry! May ECC na handang tumulong sa iyo. Ang ECC o Employees Compensation Commission ay ang government agency na nagpapatupad ng ECP o Employees Compensation Program. Maliban pa ito sa makukuha mong benefits from SSS at GSIS. Kapag nagkasakit o na-aksidente sa trabaho, mayroong loss of income benefit na pwedeng maklaim. Mayroong tatlong klase nito. Una, temporary total disability o sickness benefit kung saan ikaw ay nagkasakit o naaksidente at kinakailangan mong umabsent ng ilang araw hanggang 8 buwan. Pangalawa, permanent partial disability. Ito ay kapag may nawalang parte sa katawan mo o kaya function ito. Pangatlo, permanent total disability o yung kapag di ka na makabalik sa trabaho dahil sa sakit o aksidente. Maliban sa loss of income benefit, meron ka pang makukuhang medical benefit from ECC. Ito ay reimbursement sa mga nagastos mo sa gamot pati na rin sa ospital at medical care. Kung ikaw naman ay nagkaroon ng permanent disability, may karagdagang benepisyo ka pang makukuha mula sa ECC. Ito ay ang Carrier's Allowance, kung saan magkakaroon ka ng karagdagang 1,000 pesos per month. Kagaya ng SSS at GSIS, mayroon ding death and funeral benefits mula sa ECC kung work-related ang sanhi ng pagkakamatay ng employee. Sa private sector, doble benepisyo ito dahil iba pa ang death and funeral benefits ng ECC sa SSS. Samantalang sa public sector, ay funeral benefits lamang ang pwedeng sabay na i-claim. Pagdating sa death benefits o pension, ay pipili ang iyong beneficiary kung EC o GSIS benefits ang kukunin. Ito ay dahil sa exclusiveness of benefit policy ng GSIS. Maliban pa sa mga yan, meron ding rehabilitation services ang ECC para sa mga PWRDs o persons with work-related disabilities. Kabilang sa mga rehab services na ito ay free psychosocial support, physical o occupational therapy, vocational at livelihood training, at assistive devices gaya ng prosthesis at wheelchair. For more information, pumunta lang sa pinakamalapit na ECC office sa inyong lugar. Remember, kahit may ECC, lagi ka pa rin mag-ingat ha!
Ikaw ba ay empleyadong nagkasakit o na-aksidente ng dahil sa trabaho? Alam mo ba na maliban sa SSS at GSIS benefits, ay may karagdagang benepisyo ka pa na maaaring makuha mula sa Employees Compensation Program? Tama! Covered ka ng ECC, basta mandatory member ka ng GSIS at SSS. Kasama ang mga self-employed members, sea-based OFWs, mga kasambahay, at lahat ng mga uniformadong personnel ng AFP, PNP, BJMP, at PFP. So, paano nga ba makakapag-claim ng EC benefits? Sa pampublikong sektor, magpunta lamang sa pinakamalapit na GSIS office o branch sa inyong lugar. Sa pribadong sektor naman, ay sa SSS office o branch ang filing ng EC claims. Pagdating naman sa mga requirements, dalhin lamang ang mga dokumento gaya ng Accomplished EC Sickness Disability Form, Certificate of Employment, Medical Record, Incident Accident Report. Ang kagandahan sa EC program ay 3 taon ang restricted period nito at hindi kinakailangan na ubos mo na ang iyong sick leave credits bago makapag-file ng claim. O diba? Good news! Sakali naman na ma-disapprove ang iyong EC claim sa SSS o GSIS ground, maaari kang mag-file ng motion for reconsideration sa main office ng mga ito. Pero kung denied pa rin ang kanilang decision, maaari kang umapila na mismo sa opisina ng Employees Compensation Commission. Dalhin o email lamang ang iyong mga dokumento at ang denial letter ng iyong EC claim mula sa SSS o GSIS upang maproseso ang inyong apila. For more details, follow and message us on our official Facebook page at ECC Official or search for the Employees Compensation Commission. Remember, kahit may ECC, lagi ka pa rin mag-ingat, ha?
Thank you. We proceed with our next slide. Okay. We have mentioned po yung ating mga related benefits. Kabilang na po yung tinatawag nating cash assistance. Kung sakasakali po meron tayong approved EC claims, either in the SSS or GSIS, maaari po kayong mag-apply ng ating po tinatawag na cash assistance sa ECC. On the screen po, nandiyan po ang ating mga requirements. For approved disability benefits, meron po mga possibility po tayo makatanggap ng amount na 10,000 pesos. For approved EC death benefits, ang mga beneficiaries po ay maaari makatanggap ng 15,000 pesos. So we proceed on our next succeeding slide. For the few remaining precious minutes allotted to ECC, banggitin lang po natin, EC benefits are distinct and separate from SSS and GSIS benefits. Ang contribution po nito ay nanggagaling lang sa ating mga employers. For the private sector, nanggagaling lang po sa ating mga respective agencies sa ating pong public sector. So, ang ating pong venue of filing for the private sector, SSS. For the public sector, ang venue po ng filing ay GSIS. So, in terms of purpose, paano po natin madidistinguish ang EC benefits sa SSS o GSIS benefits? Tandaan lang po natin, ito po ay patungkol lamang sa mga work-connected disability or death due to sickness or injury. Yan lamang po ang tangi at bukod tanging dahilan ng pagbibigay ng benepisyo. Maaaring nyo sabihin nyo na napakaganda ng programa, pero ganun pa man, kinakailangan din po natin mag-ingat, lalong-lalo na po sa panahon ngayon. So maraming salamat po sa pagkakataong pinagkaloob po sa Employees Compensation Commission at tayo po ay maging ligtas sa lahat ng pagkakataon. Maraming salamat po.
Thank you, Deputy Executive Director Villasoto.